show you guys as well, because we're not just talking about communication from patient to patient, we're also talking about communication within medical careers. And I'm sure maybe you might have already heard from people today, or you might just know yourselves that there's so many options in terms of fields you can go into with medicine. But even trying to apply that communication with different fields, it's not just patient to patient. So you might have doctors that work in public health, for example, and their form of communication is very much going to be informing the public, raising awareness, and that could be in things such as screening programs, so preventative measures as well. There might be cases where doctors have to go to court, for example, with psychiatrists, things like that. They may have to represent a patient, or they may have to clarify some medical piece of information. Then you've got communication within the different kinds of care. So between a GP practice and the consultants in the hospital, that level of communication between primary and secondary care is so, so key. And it's not something you're necessarily taught textbook, but it's something that you gathered through the degree. Then research. People seem to always think that doctors just do medicine and they just leave everything else. But a lot of doctors are actually involved in research, because obviously they've got, frontline experience of some of the things that we need to kind of improve in a science element. So if research science is your thing as well, those options are still there for doctors, whether academically or more like science-based and lab-based. And then we kind of touched on families as well, communication with families, whether that's in pediatrics and, with children and their parents, but also we talked a little bit about end of life, so palliative care, those sort of things. It's not just one individual that you might be speaking to. So hopefully you guys have got a bit of a taster that would give you a bit more interest for the full course, and to kind of see how communication comes into medicine, not just in a standard just the word empathy, that's the only thing but how do we apply patient-centered care? And more of this would go into depth about like the ethics and things like that, and more complex situations. But I hope that has made sense to you guys.